South Africa annually observes October as its Breast Cancer Awareness Month. Government has also remarked that breast cancer remains one of the most common cancers among women in South Africa. It is the most prevalent cancer amongst white and Asian women and the second most common cancer among black and colored women. Scientific evidence suggests that early detection of breast cancer can lead to effective treatment, with about 90% of patients being able to survive for many years after diagnosis. Joining us to discuss how women can empower themselves with knowledge of the condition is Dr. Molefi Molefi, Chairperson of Non-Profit Care Advisory and Support Group Genesis. Doctor, thank you so much for joining us this afternoon. Now, breast cancer is the most commonly diagnosed cancer type, accounting for 1 in 8 cancer diagnoses worldwide. Why is breast cancer more prevalent than other cancers?
Well, it has been established that there's an increased awareness broadly, and so therefore there's more people that know about the disease, and simply because there's a better access to treatment amenities and people are living longer with the disease. So those are the primary factors behind, the increased number of people that are living with the disease.
Now, Doc, a richer diet, smaller families, delayed childbearing and reduced breastfeeding have driven the increase in Western countries. While South Africa has a 1 in 27 lifetime risk, what contributing factors are making breast cancer more prevalent amongst South African women?
Well, primarily we're failing on the task of getting most of us to know our status. Number one, by the way, breast cancer affects both men and women. And secondly, we're not doing all that needs to be done to modify our risks. So, and there's more people that are living with the disease.
You speak of breast cancer.
So we are aware that also breast cancer tends to affect people a whole lot more, in particular risk factors. And those are the ones that are actually bringing in a higher incidence of the disease.
Doc, you mentioned there that it affects both male and females. Are you finding any stigma around male patients coming out and testing for breast cancer or being able to even look out for those signs?
It's early work in progress. A whole lot more men are resistant because it is generally still believed within our society that breast cancer is a woman's disease, but more men are coming on the fore and getting themselves tested.
So how would one then lower their risk of breast cancer?
Well, there is some of the known factors that are not modifiable. One of the biggest ones is age. As we get older, the risk is higher, and women basically have a higher risk of getting breast cancer. So, and then other than those two factors that are pretty much unmodifiable, it's the genetic factors, because breast cancer does run, in the risk of breast cancer runs in families. If it has been there in your family, you're at a higher risk of getting the disease. That's number one. But secondly, when it comes to the modifiable diseases, like modifying your diet, modifying your weight and ensuring that you are not overweight, and also altering other lifestyle factors like not drinking too heavily, not smoking. Those can bring a significant reduction on the risk of getting the disease.
Now, Doc, in further breaking down those factors, I know that in your talks you break down the various stages in a woman's life where certain events can cause a spike in the chances of one being diagnosed with breast cancer. Can you briefly just summarize those for us?
Well, it is well known that the earlier onset of menses, that is when young girls start with their menses much earlier on in life, the chances of getting the breast cancer are then much earlier, much higher rather. Sorry. So, and other than that, later on, in life when it comes to childbearing, and what people do to protect themselves, against pregnancy and so on, there's a whole lot of other lifestyle factors that actually impact on your ultimate risks. It is also known that the risk of breast cancer is directly linked to the number of children that you have and the spacing in between, of your childbearing. In other words, if you had your child at age X and the number of years that it will take you before you have another child does have an impact on your risk. And lastly, what happens to you when it comes to your menopausal years also impacts significantly. People that have late menopause and prolonged menopause tend to have a higher risk, impacting on their chances of getting breast cancer.
So, Doc, then what should the spacing between childbearing be in order to lessen the chances of breast cancer?
It is not thoroughly proven science-wise exactly what the factors are, but studies have just revealed that the patterns of childbearing do have a direct risk, because it is well known that one of the big factors that comes to that plays a role with on the breast cancer risk is your exposure to your hormones. And so obviously pregnancy and your lifestyle, pregnancy-related factors have got a direct link to your chances of getting cancer. So that's why we know that people that have never been fallen pregnant, their risk profile then changes. So there's now an increased drive across the world to try to get people empowered to get to understand what the impact of their lifestyle, their reproductive lifestyle should be on their breast cancer risk.
Sure, very interesting. Well, while awareness campaigns such as this highlight the importance of the disease, how important is educating family members that are caring for loved ones?
It's absolutely important, particularly because in our society, one of the biggest problems that we have is delayed presentation and help seeking for breast cancer. So, and it is well known that there's quite a few barriers that play a negative role and a huge impact to reduce your chances of immediate presentation, even if you notice a problem. So some among those barriers, a lot of influences come from your immediate family folk. So it is absolutely important that the family gets to know, of what their loved one's journey is with dealing with whatever might be a breast cancer, to ensure that you optimize ultimately your your chances of getting early access such that it could be helped accordingly.
So certainly an involved family can assist one, especially in the stages of detection. Now, Genesis is preparing to host a breast cancer awareness golf day fundraiser on the 26th of October, and the chosen theme behind the event revolves around going a step further to improve access to breast cancer treatment as a means to save lives. Can you talk us through that?
We found that a lot of work that we've been doing, going out into communities to talk to people, really focuses more on enabling people to be aware of their risks, of getting the disease and identifying symptoms of the disease. But it is clear that beyond that, a lot of people have a challenge because they don't quite know what to do. So therefore, it is important that people get to know what the next step should be, because well and good, we can do as much as we can on awareness raising, but that awareness raising must also comprise on people getting to know what's in it for them, along their journey with breast cancer. In other words, if you do get diagnosed, what's going to happen to you? Are you going to get surgery? Are you going to get chemotherapy? Because there's all sorts of folk stories about what people's terrible ordeals or experiences are with taking chemotherapy, but it is not necessarily so. And so people need to be educated well enough, or to be made aware, of what they are likely to encounter as they go forward. That will improve their chances that they will continue doing what they're supposed to do, which is to help themselves and get assistance.
So in regards to that access, a group of surgeons is coming together in ensuring that they provide that access to some women who have been diagnosed with breast cancer but don't have the funds or the means to be given that access. Am I right?
The landscape, the care treatment landscape in our society, it's obviously very uneven. A whole lot of pockets of people that have ready access to care, but then there's a whole lot of other people that are not so fortunate to get access to care. As we have realized that there's a lot of challenges that people are faced with. So as a result, people do not know what to do next. So that then led to us getting into negotiating forums with other partners to try to see what it is that we could do together to be able to strengthen some of these campaigns going forward. So improving access to treatment broadly is actually of our paramount focus area right now, beyond just awareness raising. So, and it is quite clear that there's a lot of people that they have already been seen, and it has been determined that they should get some type of treatment or the other, and because of limitation of resources, they cannot be able to access treatment. So it is for that reason that we found, in ourselves that we could set up a program as an initial phase of wanting to see what it is that we could do to offer our help. That is as an NGO, as well as some of our partnering, colleagues, to see if we cannot be able to set up programs where people could readily get a better access, even if they are faced with the challenge of not being able to get on a long waiting list out in hospital. So we are partnering with a group of specialist surgeons, as well as plastic surgeons coming from, particularly mainly at this juncture, from Wits University. But we do hope that we will collaborate, in fact, with other colleagues from other institutions. We're also collaborating with some hospital groups from the private sector that have agreed to come on board to support this campaign by just making more theatre time available for some of these people that are not so fortunate to get access to treatment simply because the resources are limited in the hospital where they've been waiting to get care for way too long. So yeah, it's early days. This was the beginning of this very ambitious campaign. So we hope we'll be able to get the support that we need to be able to drive up this campaign, and hope to bring in more partners on board, both from a funding perspective as well as other partners, doctoring groups, as well as hospital groups that may want to let us utilize some of their available amenities.
All right. Thank you so much for that, Dr. Molefi, and for the contribution that you are making in this space, which is quite needed. Thank you so much for your time. That's Dr. Molefi Molefi, who is from the Genesis, which is a non-profit care advisory and support group.